What would you say like the 3 things that people come and see you for most?
Pain, painful sex and pain postpartum or during pregnancy. And those 2 would be like painful sex and the pubic bone pain or tailbone pain. And then probably leaking.
Mm-hmm.
And then concerns they have prolapse or so it's probably the top 4 because it'd be pain, leaking are the top 2, and then concerns about prolapse and resuming exercise or concerns about diastasis and resuming exercise.
Can you explain those a little bit?
Yeah,
Exercises.
diastasis is when you have the separation of the ab muscles. And so a lot of women are like, well, I think I have some, but I don't know. Again, same thing. I don't know how bad it is or what to do about it or if I need to get it treated or if it'll heal on its
Do
own.
I have ab muscles?
Do I have abs? Have you seen that video like of the 20-year-olds and like their abs and like and the 40-year-olds and like, hey look, I think I got an ab. Yeah. So those are probably, so diastasis is a split down the middle. And so 2 misconceptions with that is 1, we all have a little gap. Like the muscles attach here and then they meet here. This should never be solid all the way across. And so I think too, then like it's normal for the gap to be a little bigger at the belly button. But then when you think about like tenting or bulging, again, women don't know if it's like a normal and they just need to strengthen or if it's something they're gonna make worse by doing crunches. They don't, and online, God bless all the people who are trying to do programs because I'm all for people helping other women and I'm all for more information getting out there. But it's hard for when I have a lot of clients that come in and they're like, well, I tried to do this, but then I didn't know if I was doing it right. You can't learn that from a video. That person on the video is not watching you or looking at your situation.
Yeah.
So again, that's usually a 1 or 2 session teaching them what is normal, how they are doing, and how to correct whatever pieces they need. Sometimes it's a couple cues from me about, no, your lowers are actually kicking in, your ribs got really flared, how you personally carried baby. Like, let's get those top abs to kick in again so you feel like you have more stability in your core and your whole posture. So those are usually pretty quick pieces to check out and correct if needed. So that's diastasis. Prolapse, was that the other one?
Mm-hmm.
So prolapse means your parts are falling out. So there's several different, right? Varying degrees. I actually have a PowerPoint on my laptop, but the vaginal walls themselves can kind of get stretched and sag and be kind of falling into the canal a little bit. They can be slightly sagging, medium sagging, or like outward bulging. So I had a client, it kind of did legit look like a baby's head was crowning when she sent me a picture before she came in. And I didn't know what that was. And she was really worried it was her uterus falling out and that she was gonna need surgery. She's on her 4th baby, all her babies were over 10 pounds. And I mean, on the phone, I was like, your uterus might be falling out and you might need surgery, but like, let's just see what's what. Turns out it was mostly her vaginal wall tissue, and we were able to strengthen and restore some of the tissue tension in her pelvic floor. And between myself and one other practitioner she worked with, she avoided surgery. She didn't need surgery and she stopped leaking and things weren't bulging outside. It's rare that I see a client so severe that something's bulging outside. Sometimes, a lot of women will report, like, I wipe and there's pressure there. But, so, the vaginal wall can kind of cave in. The bladder can sag and drop into the vaginal opening. Your uterus can drop down into the vaginal opening, or you can get, your rectal tissue can bulge. I'm gonna get a picture in here. And so, a lot of times women will talk about having to kind of splint to poop, and it's because like, so, and that's why I'm a big fan of Squatty Potty, but like when the colon comes around and plus they use unicorns in their commercials.
I was gonna say the commercial is the best part.
Right. It should go out straight. So a lot of times there'll be thinning of the lining between the rectum and the vaginal canal, and so there'll be like a bubble where the rectal tissue bulges into the vaginal canal. So not only does that feel like a lot of vaginal pressure, the poop can kind of get stuck in that pocket instead of going straight out. And so women will either have to splint, which means they put their fingers in the vagina to straighten back out the tube, or they'll put pressure on their perineum to make it just go out the poop and not into the bulge. That's pretty easy to fix without surgery.
I feel so grateful right now.
Right? But again, there's, even with prolapse, people are scared to get checked, they're scared to ask those questions, but there's a lot of steps between doing nothing and hoping it gets better, and surgery. There's a lot of steps in there, and almost all the time we can avoid surgery.